Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is May 10, 2025. This video is a recent paper published in JACC Advances titled Concussions are associated with increase in blood pressure and cardiovascular risk in American-style football athletes. Concussions in American-style football are common, but their cardiovascular impact is unclear. This study investigated whether concussions lead to elevated blood pressure and cardiovascular maladaptations. The hypothesis was concussions independently predict increased arterial stiffness and hypertension. So the investigators did a longitudinal case-control study of 78 college athletes, 39 with concussions and 39 controls. They measured blood pressure, pulse wave velocity, which is arterial stiffness, LV mass index, and tissue Doppler E prime velocity, which is diastolic dysfunction. The time points: baseline before concussion, 1 year post-concussion, and 2 year post-concussion. Key findings: after 1 year, concussed athletes had increased pulse wave velocity, indicating arterial stiffness. After 2 years, there is significant increase in systolic blood pressure, greater than 10 millimeters of mercury, and diastolic blood pressure greater than 8 millimeters of mercury, and increased LV mass index, suggesting LV remodeling and hypertrophy. They had reduced diastolic function, as shown by decreased E prime velocity in concussed athletes. Concussion was independently associated with higher arterial stiffness, diastolic blood pressure, and LV mass index. The key takeaways: concussion can lead to long-term cardiovascular changes beyond neurocognitive effects. Routine blood pressure monitoring in concussed athletes is essential for early hypertension detection. Further studies are needed to explore long-term cardiovascular risks in other sports and demographics. This cartoon, which is the central illustration from JACC Advances, captures the key message from this paper. Essentially, there is increased systolic blood pressure, pulse wave volume, increased LV mass, and increased diastolic dysfunction. Interestingly, just recently did an earlier podcast on the effect of blood pressure and uncontrolled hypertension and dementia, which is just the inverse of this podcast, where brain damage causes arterial stiffness and hypertension. So it's kind of a mirror image. Podcast brought to you by Master MedFacts at mastermedfacts.com.